So yes, I've run the gamut of all kinds of medical institutions where you can work. And of course, that does also include like 20 years, nearly 20 years in the UK's National Health Service, where I worked in so many emergency departments, I lost count. But all fun and games. Today, I'm going to tell you that the hard problem is not hard at all. What is the problem in question? The US healthcare system. Why do I say it's not hard at all? Has anybody seen this guy? Malcolm Gladwell. Great chap, wrote lots of books, lots of big ideas, just like me. Now, he said of problems and situations that we sometimes get into in this world, you need to know if it's a mystery or if it's a puzzle. I don't think he invented the phrase, but he did make it popular. And his description of a mystery is the sort of problem that you don't know all the bits that go into it in order to solve it. And you can't simply solve the problem by getting more information. As a matter of fact, in a mystery, you go into it thinking you're doing well, and you might actually make things worse. The law of unforeseen circumstances often takes over, and things get deeper and deeper and deeper. He used the Enron scandal as one example, but any of one of us can think of so many others where we think we know what the solution is, and we realize we don't know, haven't got a blinking clue what we're doing. Those are mysteries. Mysteries. Tell your neighbor it's a mystery. Nudge your neighbor. Wake him up just after lunch. Tell him it's a mystery. A puzzle, however, is different. A puzzle is a problem where all the pieces are there, you just don't know how to put them together. You solve a puzzle with more information. Think of a jigsaw puzzle, 10,000 pieces in it, but all the pieces are there. A crossword puzzle, the clues are there, you just don't know how to work it out. You can cheat, you can ask a friend, eventually you can solve the puzzle if you have enough information. The US healthcare system is a puzzle. It's not a mystery. It's a big problem, yes, but it's a puzzle. It's not a mystery. Everything we need is there. We've got the money, we have the resources, and if you think we don't have the money, I will prove you wrong. This is America, and by the way, don't let my accent deceive you, I'm an American as well. Wealthiest nations by GDP. If you can't read the slide, I will tell you, the US has got 30 trillion in GDP. Our closest rival, China, is still at 19 trillion. Can you see the difference? As a matter of fact, if you add up all of these, Germany, India, Japan, the UK, France, all of the GDPs of these countries, it does not equate to that. That's how much money we've got. So if anybody tells you we don't have the money, they're lying to you. I alone will tell you the truth. Now, for those of you who want to split hairs about, well, it's GDP, it's not, per capita income, and it's, yes, you're right, the bigger the population, the more money it takes. But having said that, even if you look at the list of per capita income, countries by per capita income, the United States, if you use per capita income as accurate as the PPP, which I like to use because it does take into consideration that $1 spent in the US is not the same as a yuan spent in Beijing in China. What's your real purchasing power and what is your true wealth? That's what PPP does. Per capita income by PPP, the US looks like it's in like the 13th position, but if you look at some of the countries in that list, they are tax havens where the wealth that they have on the books doesn't belong to the population. If you pull out all those countries, the US comes about number 6 or so, or number 5, which is not bad considering you've got about 190 countries in the world. But my point again, it's not so much how much money each individual has got in his pocket. It's what we have as a collective. This is why the US was able to do the Apollo project. This is why we were able to do the Manhattan Project that invented the first nuclear bomb. This is why we were able to do so many things that the Europeans scrambled together to put a satellite in space, the Ariane project or something like that. It took like 3 or 4 nations. The US did just one country. It's the thing about having so much resources in one country means you can make major moves that other countries struggle to put together. Somebody say USA. I like it. What do we spend all our money on? The military, right? Nope. Most of us here are probably aware of the fact that our federal military expenditure, last year's budget, I think, was at $850 billion. Health and Human Services, however, was at $1.2 trillion, most of it being Medicaid, Medicare. Where do you think, well, I've already given the game away, I suppose, because I think the last speaker before lunch mentioned some of this. So you probably already know that the USA is at the end there, and we are. But by how much do we beat everybody else? Trust America. You would think that because we've got so much wealth, we would have a lot more expendable income. We don't have to pour it all into healthcare. We can use it for other things, like defense, or like playing hard games. You know, work hard, play hard. That's the American ethos. But to put, 16% of your GDP in healthcare, nobody even comes close. The average, these are OECD countries, is nearly half that. What are we doing with all that money? As I like to say, it's all for a good cause. Look at this picture. This came from New York Times a couple of weeks ago. Very interesting. It shows you the top employing industry category per state. Blue means manufacturing, as you can see. Yellow, orangish is retail. Then you've got hospitality and public administration. As you can see, back in 1990, most of the US states, their biggest employing industry was manufacturing. Even California, forget Hollywood, Oregon, Washington, you name it. That was in 1990. To me, and I might be dating myself here, that doesn't seem like it was a very long time ago. That was in my year before last in medical school. That was like just then. As at last year, show me the color of purple. It doesn't even appear on the first map. The healthcare sector is now the biggest employee in those 38, nearly 40 states. That's you, me, most everybody in this room. I need to calm down, right? All right. As I said, it's all for a good cause. The United States easily dominates the world's biotech sector with an estimated value share of nearly 59% in 2021. This is almost instinctive to most of us here. We know that the US dominates in biotech pharmaceuticals. Do you know that 50% of all new drugs coming to market are developed here in the United States? The other 50% is divided among Germany is one of the big contenders, Germany, the UK, even Israel. But they're talking in units, 12%, 18%, 2%, whatnot. The US, 50% of new pharmaceuticals coming to market comes from the US. This is not just made up stuff. The nation's leadership in the science and technology sector, where it ranks first, say it with me, is bolstered by its world-class research universities and a thriving biotech industry. That is America. So we have the money, we have the resources. Obviously, we have the world's best healthcare system. Stop laughing. We ought to, right? I mean, if you came from Mars and landed on this planet and looked at all these statistics that I've given you thus far, what would you conclude? In this world, this country must have the world's best healthcare system because they've got everything they need to make it that way. But we don't. A few more statistics. Now, I often tell people I don't start or even include life expectancy because there are just too many variables that can cause life expectancy to be low. But spoiler alert, we do have a low life expectancy compared to everybody else. But maybe it's because we're American, we like to do crazy things. Part of the reason why I left other countries and came here, because I'm a bit crazy like that. But let's take something serious like infant mortality. What's infant mortality? For every 1,000 babies that are born, how many of them make it to their first birthday? Well, to be brutal, how many of them die before they're 1 year old? It's a morbid statistic. For most countries in the OECD, most wealthy countries, it's 2 or 3 babies out of 1,000. Estonia, Japan, Norway. When you get to Austria, Portugal, Ireland, you're getting at 3 babies per 1,000. The middle group here, they're still at 3 babies per 1,000, Lithuania or whatnot. Don't worry, we'll get to the UK eventually. The naughty panel over there, the UK is at 4, but the United States, it's 5. Now, 2, 3, 4, or 5 out of 1,000 doesn't seem like a lot, but in the global picture of things, remember what I said about our resources and what we've got. There is no reason why we should be over there. We ought to be here with Estonia and Japan and the rest because of what we've got. Now, if you go to the maternal mortality rate, which is how many women die in pregnancy with pregnancy-related illnesses out of 100,000, it's even worse. Most OECD countries are 6, 8 women that die. For the US, depending on which year you choose to analyze, it's between 18 to 22. We're letting our women down. Treatable mortality. Let's talk a bit about this. I mean, the idea of avoidable deaths became quite popular during the COVID pandemic. Avoidable deaths is divided between two different broad categories. You've got your preventable deaths, then you've got your treatable deaths. And the difference is, preventable deaths is a statistic that measures how many people die from diseases that could have been prevented by social issues. Think about immunizations, programs that prevent illnesses from taking place in the first place. If you get your colonoscopy, they see a polyp, they take it out, you never get colon cancer. Hence the term preventable. If you have that sort of system in place and it's failing, then people who get colon cancer despite that system, that is called a preventable death. Or immunizations, things like that. So that shows a mirror of the social issues that may lead to mortalities and the systems that are or are not in place. Let's not go there. Let's just stick with treatable mortality. Treatable mortality is a measure of people who die from conditions for which the treatment exists. Think about somebody with lobar pneumonia. Simple lobar pneumonia. What do we need? They need some antibiotics, amoxicillin. You give it to the chap. He takes it for 10 to 14 days. He gets better and he goes home. We have the antibiotic. If somebody dies from pneumonia, despite the fact that we have the antibiotic for him, that is called a treatable mortality. It's tragic that we have the treatment, but the person died anyway. It's a very good measure of how robust your healthcare system is. Now, if you've been staring at the board while I was talking, you would see that the USA is in the 28th position out of 45 countries. I like to say that had this been the Olympics, and instead of being on the podium, first, second, or third position, USA was in 28th, you would demand your money back. How can we possibly be that far back with all that we've got? No explanation for it, but it's not all bad news. I like to say our cancer survival rates are a bit of a mixed bag. 5-year breast cancer survival rates, best in the world. That's America for you. The 5-year cervical cancer rate, though, we're in the 25th position. So I say it's a bit of a mixed bag. And if you look at it, prostate cancer, lung cancer, compared to other parts of the world, some up, some down. My point is, we are supposed to be at the forefront with all that we've got. We should always be like number 1 or number 2, number 3 at best. No excuse for it. Countries with the highest density of doctors. Maybe we don't have enough practitioners in this country and that's why we are failing. See where we are. 2.6 doctors per 1,000 is the USA, the UK, Germany. Look at Germany. 4.5 doctors. It's nearly twice what we've got in the United States. Perhaps it's because medical school is expensive here. I was asking somebody earlier on, how much do you think the Germans pay to go to medical school? If you go to a state school, think FIU, Texas A&M, Penn State. If you go to a state university in Germany to study medicine, your tuition is zilch, nada, zero. Here we are arguing about whether we should pay for or not pay for student. But at the end of the day, this is what you get. I am not here to offer the solutions. I'll tell you that. I'm probably not that smart. I am here, however, to give you this sort of 30,000-foot view of what's going on and where I think we're going with this. Okay, so there's an elephant in the room. Universal health coverage, isn't it? Now listen. Universal health coverage is not what many people think it is. I'm going to give you the WHO definition. It's not free health care. It's not socialized medicine. Oh, I hate that expression. By WHO, their definition refers to that all people, read it with me, have access to the full range of quality health services they need when and where they need them without financial hardship. Emphasis is mine. Quality health services without financial hardship. However you as a country, as a nation, decide to achieve this, it's up to you. Every country does it differently. However, it's something of a rite of passage to call yourself an advanced Western nation to have universal health coverage. And I'll show you. We're sort of the odd man out, but let me not get ahead of myself. This bar chart shows you how these countries do it. Most of these are OECD countries. In the UK, 100% of the population is covered by government insurance. 10% have private insurance in addition to the government insurance. It's called PMI, private medical insurance. I never had it when I lived there. What did I need it for? The NHS took care of everything. There was no point in paying extra. But some people get that from their employer and all whatnot, so you get to go to one of those private hospitals where they have carpets on the floors. I've worked in one. It's jack all, just carpet on the floors, that's all. Telling the honest truth. Germany, they've got a fantastic system, which if I had time, I would tell you about, which looks very similar to the United States system, but they've got 100% coverage by what the government provides. There's also private insurance. And it goes all the way down like that. The only odd thing is this one in the middle here. It's like we call it the United States. What have we got? 38% is what we've got covered by government, Medicaid, Medicare, and stuff like that. 62% are private insurance. Now, there's overlap there. Let me explain that to you a bit more. It used to be that the US would say we've got like 88% of the US population has health care insurance in one form or the other, or both. Then the Affordable Care Act kicked in and they bumped it up to 90, 91, and I think 92% of the population has health care insurance in America. But what's very significant is a lot of the insurance we describe does not meet the WHO definition of universal health care, either because it's not affordable or doesn't provide them with adequate healthcare services. Very important. What percentage of the United States population has insurance that provides them with robust healthcare insurance without leading them to financial ruin? That is not a typo. 57%. In small print, 66% for children. This is for adults. So where the rest of the wealthy countries are getting 99 to 100% coverage with robust healthcare, we're at 57%. What is the other 43% that's missing? I'll explain. Glad you asked. At the time when this study was done in 2022 also, 23% of them were insured all year, but they were underinsured. And I'm sure most of us know what that means. You've got insurance. However, the deductible that you have is so high that it never kicks in all year. So you pay out of pocket for all your services. If you want a lower deductible, then you pay a much higher premium. I've been there when I first came to America in New Hampshire. The government, the group I worked for, they told me, look, Greg, don't bother getting a low deductible. I tried, put the figures in, bing, springs back at me. I'd be paying over $4,000 a month for my insurance with that group. So they told me, the other doctors in the group said, just get the high deductible. You pay a low premium, but you're rich, you're a doctor, you can afford to pay out of pocket for most of the things that happen. And I did. My daughter went to the ER for a minor injury, boom, $1,200. Needed an EKG for something they saw which was nothing, boom, $1,200. Out of pocket every time. And I had insurance. All right, calm down, yeah? Okay. I'll get that. It's painful though. So, and that's me, I'm a physician. Think about the people who cannot afford it. The only insurance they've got is what they've got, and they can't pay out of pocket for many services, so they do without, and they've got insurance. The other group of these guys, 11%, who were insured at the time of the study, but they had coverage gaps, changed their job, had to move somewhere else. The coverage gap could be a couple of weeks, you don't notice it. It could be several months. But sometime during that 1 year when the study was done, they had a gap in their coverage. And what do you do when you have no insurance? You manage without, pay out of pocket. And then the 9%, which we also always tout, these are the only ones who are uninsured. They're the ones who during the study had no insurance at all. But it total added up to 43%. The other 57% were the Americans that had real good coverage that would give them the health access that they needed without financial hardship, while everybody else is getting 100%. We've all heard of exponential growth. That's an exponential growth curve. Let me explain what's really going on here. This curve is based on a story of a young lad who asked his dad for extra allowance. He's getting $5 a week. Father says, that's enough. Kid says, oh, give me some more. Father says, no. Eventually, the kid convinces his dad, give me a penny a day for a month, but double the penny every day. Just start with a penny, double it every day. So on day 2, he gets 2 pennies. On day 3, he gets 4 pennies. On day 4, 8, 16. You know, by the end of the week, though, he's got like 64 pennies. Next week, he's going up. Before you know it, he's getting a few dollars. Then he goes up, and then he goes up. But something starts to happen around here, shoots up like a rocket, and by day 31, he's on just under $12 million. That is exponential growth. Now, what people often refer to as exponential growth is this hockey stick you see here. What they don't realize is an exponential growth curve starts here. The doubling started on day 1, but it wasn't noticeable until the inflection point here. My question, with what's coming on now, will you be an early adopter? You're probably wondering what is coming on and how is it going to happen? I'll tell you. It just takes one company, one corporation, or several to pick on the fact that the mood in the country has changed over the years. People think differently about healthcare now, and they will exploit that loophole. Who's heard of GoodRx? GoodRx is able to offer, I first heard of it back in 2014, around that time. It's fantastic. They're able to offer medications at such a low price, prescription medications, to people who have no insurance. How do they do it? They've manipulated the system. They've seen a loophole. The PBMs are still making their money. The Joe Public who uses GoodRx gets a cheaper drug, saves money. Who's losing? The pharmacies. There's always somebody to come in when they see where the mood of the people is and take an exploit. Mark Cuban has got his cost plus drugs. We've got his, hims, hers, Amazon. Everybody's stepping in because there is an opportunity here. Worst thing is, if some politicians get together, stick their finger in the wind, see the direction in which things are going, and say, let's make some policies to finally begin to clog those loopholes. You don't want to be left behind when that happens. Will you catch it when it kicks in, or will you be left behind like the switch watchmaking industry or Eastman Kodak? Go and read about that. Thank you very much, everybody. If you've got any questions, let me know. Scan the barcode, connect with me on LinkedIn, and we can talk about it.